According to the latest recommendation by the American Heart Association, we now see that the old recommendations with your blood pressure being allowable at 140 over 90, well, now it's been brought down to 130 over 80. And what did that do? Well, previously, 32% of us were in that situation where, we had hypertension. Now, 46%. So 14% of us were caught in the crosshairs of this change, this recommendation. And when I say yes, I literally mean like me. I was taking a look at that and going, oh, great, because I was right below hypertension before, and now I am part of this new statistic. And here to tell us what's going on and what we should be considering to try to improve our health and make sure we're on the healthier side of this equation is Dr. Parikh, an interventional cardiologist with the Texas Health Physicians Group. Dr. Parikh, first, what is your expert opinion on this change in recommendations by the American Heart Association?
Well, good morning. Thanks for having me. And just like you mentioned, what used to be called borderline, what's happened is if we follow those patients over a long period of time, they actually have a double the amount of risk of having cardiovascular events such as heart attacks or strokes or increased risk of kidney disease. So what we recognize, what used to be kind of borderline, well, we kind of want to make those patients aware that this is just more than borderline. This is actually increasing your risk of long-term heart disease, which is exactly what we want to avoid and what we want to prevent. And so the new guidelines kind of focus on what was previous borderline or pre-hypertension and went ahead and labeled them as stage 1 hypertension if your blood pressure is above 130 over 80. So that could be concerning. Just like you mentioned, I have patients that I've followed for a few years, and all of a sudden I see them yesterday, and suddenly, you have high blood pressure. So what does that mean for you, including yourself, or whether you're out there and your blood pressure falls in this new range?
Right.
I think the first thing to remember is it doesn't mean that you have to rush to medication. The guidelines, while they focus on changing what defines high blood pressure, it also focuses on the initial strategy in tackling this problem is to look at your lifestyle, look at your diet, because if we make changes in those, and of course it's hard to do, we struggle with these things every day in our busy lives, but if we try to take time to eat a better diet, low salt, less red meat, more fruits and vegetables, more whole grains, and incorporate exercise and activity into our lives, that could have anywhere from a 2 to 4 to 8 to 10 hypertension. You want to start with those lifestyle changes and then eventually potentially have a discussion with your physician about medication.
How big of a role will stress in one's life play in hypertension?
Yeah, stress can definitely play a role, especially if you check your blood pressure right after a stressful work meeting, a stressful home event, an argument with a family member. So the way we recommend checking blood pressure is to be seated in a quiet room for 5 minutes. And you can even take 1 or 2 readings and average them out and see what your blood pressure is. So you don't want to take your blood pressure right after you've been active or right after you've been rushing to do something, because that can play a role. In the long term, overall emotional stress and anxiety can drive up your blood pressure as well and cause more strain on the heart. So there is definitely a role of lifestyle, stress, diet, and exercise in trying to manage your blood pressure. Although sometimes, even when we manage those things, we end up needing medications. I think the new guidelines just focus on a lower set of numbers because we've kind of been, I don't want to say ignoring, but been calling it borderline or letting it ride a little bit, seeing how it goes. But now it's time to say, like, hey, we really need to address these numbers and try to make some changes.
Well, I'll tell you, it caught my attention. The irony is I might have added to my stress, which might not be good, but you got my attention.
I agree. I do agree with that. I kind of get the same sentiment from some of the patients I see, and that's why I try to stress to them, like, hey, this doesn't mean that you need to start medications for the rest of your life. But this does mean that, we need to address this number, and you need to make some changes in your lifestyle and at least follow this number. And if we start with that, then we've made good progress in trying to recognize your risk factors for heart disease and trying to treat and prevent them. And hopefully that puts you at ease as opposed to increasing your stress.
I like that thought. We'll leave it there. Thank you. Have a great weekend. We appreciate with the information,
right.
even if it's what we don't want to hear, but what we need to hear today. Dr. Parikh, interventional cardiologist with the Texas Health Physicians Group.
You know how you go to the big box store, maybe the pharmacy, they've got one of those little complimentary high blood pressure checkers. You sit down, you put your arm in the thing.
You ever done that?
Yeah, a lot. And I will confess that I'm slightly north of 130 on that first number. I've been consistently north of 130 for a while now. Every now and then I go a little bit below that. I don't know if it's the time of the day or not, but
it is. It fluctuates.
Is that what it is?
Yeah, it can fluctuate from hour to hour, actually.
Yeah. And I know
according to what my doctor says.
Yeah. And well, I guess now that it is officially 130 over 80, I suppose I'm an early candidate for high blood pressure. Dr. Parikh is our guest on the Morning News. What say you, Doc? I know you heard me talk about that. Should I be concerned that my numbers were on and off over that 130 mark?
Good morning, guys. Yeah, that's a great question. You know, I saw a patient the other day in a similar situation. I followed him for a few years, and all of a sudden, the next time I see him, we have to talk about his blood pressure. But when you look at blood pressure, it does increase your risk, long-term risk, of having stroke and heart attacks. And I think that's what these new guidelines are trying to do, not necessarily saying that we need to treat every single number that's 132 over 82. But if your blood pressure is consistently running in the 130s over 80s, that does put you at a higher risk for long-term risk of stroke or heart attack or kidney disease even, and to gain awareness of the higher blood pressure and try to work on that, not necessarily through medications initially, but try to work on some dietary changes, eat more fruits and vegetables, less salt in your diet, and trying to be more active. You know, some of those things that we already know, but are sometimes difficult to get to in our daily lives.
Dr. Parikh joining us on the Morning News. The high blood pressure marker goes down from 140 over 90 down to 130 over 80, and that's what we're talking about in the Morning News.
Dr. Parikh, Tim Sullivan here. Is it really that simple? It seems simple. A simple solution to just, change up your diet. It doesn't seem to be that difficult. Less sodium, more potassium, more fruits and veggies. Is it really that simple?
Sometimes, in our daily lives, with work and family, we kind of skip over the simple things. In reality and practically speaking, let's say you decrease your salt intake and improve your diet. There's a wide range in improvement in blood pressure that some people will see with that. Some people will see a drop in blood pressure of just 2 to 4 points, and some may see a drop in 5 to 10 points. But in combination with a healthy diet, healthy lifestyle with exercise can significantly drop your blood pressure in a regular activity of 90 to 120 minutes a week. So, that could be 4 15 to 20-minute sessions can drop your blood pressure another 5 to 10 points. So I think it sounds simple, but I think we know that sometimes it's hard to incorporate these changes in our lives over a long period of time. But it can be as simple as recognizing that you might be at increased risk for heart disease and trying to work on those things. And if those things don't work, having a conversation about your physician about potentially being on blood pressure medication.
Yeah, that's what I was going to ask. At what point does that happen?
The medicines.
So there's a few things you have to factor in. For example, if you have some higher risk for being at heart disease, and that includes things such as diabetes, if you have kidney disease, certainly if you have a prior history of having a stroke or heart attack, even before these guidelines came out, we were much more aggressive in treating your blood pressure. So if you have any of those coexisting or comorbidities, we are more aggressive with your blood pressure and treating you with medication. If you don't have those comorbidities and you're not at increased risk for heart disease based on other things like your cholesterol and your age and your family history, I think what these guidelines are stating that if you're in the 130s over 80s, we're calling it hypertension, but we want you to be aware of it and start to work on the lifestyle changes. But then certainly to treat it if it's above 140 over 90.
With Texas Health Physicians, Dr. Parikh joining us on the Morning News.